How to remove a PICC line. A PICC peripherally inserted central catheter is a type of catheter normally inserted in the upper arm. A PICC line is a safe, stable way to deliver intravenous IV medications. It can stay in the body for weeks or months, alleviating the need to subject your veins to the numerous needle sticks necessary if the PICC was not there. Following medical treatment, a patient's physician will decide when it is safe to remove the PICC line. Patients should use this article for information purposes only. Some information, in steps, tips and warnings, is included on flushing the line and preventing clots. Removing the catheter. Be aware that only doctors or registered nurses can remove a PICC. Otherwise, serious complications or infections could arise. Only proceed with these steps if you are a registered doctor or nurse who is qualified to take care of the patient. Wash your hands. Before you begin the procedure or touch any of the materials required for the removal of the PICC line, wash your hands thoroughly with antibacterial soap and put on a new pair of sterile gloves. This reduces the chances of the patient developing an infection. Prepare the materials for removing the catheter. Place all the materials that will be used throughout the procedure, so you will have them easily at hand. These materials will include a pair of sterile scissors, some air-occlusive dressing, a stitch cutter, sterile dressing packages and cotton balls soaked in betadine solution. Systematically arrange all of these materials near the patient's bed before the procedure, so they are orderly and easy to reach. Explain the process of removing the PICC line to the patient. This is to establish trust and cooperation by the patient. Be ready to reply to any possible questions about the procedure that the patient may ask. Get the patient into the correct position. Before you begin the procedure, ask the patient to get into the correct position. The patient should be lying flat on his or her back, facing upwards, with all four limbs in contact with the bed. This is known as a supine position. Make sure the patient has a clean bed, with fresh sheets. This helps to make the patient more comfortable and avoid infection. Clean the skin around the catheter. Get a cotton ball soaked in betadine solution and clean the area around the PICC line, moving from the skin nearest the catheter outwards. This is an important step, as it cleans any bacteria from the surface of the skin, reducing the chance of infection. Once you've cleaned the skin, turn off the infusion set and prepare the dressing patch so it is ready to apply immediately following the procedure. Remove the catheter. Using a stitch cutter, carefully cut and remove the suture that holds the PICC line in place. Ask the patient to hold his or her breath, then, using your dominant hand, slowly pull the catheter out in the opposite direction of insertion. Do not apply any direct pressure on the insertion site. Upon removal of the catheter, immediately cover the insertion site with sterile gauze and hold it in place using light pressure. 4. Ask the patient to continue holding their breath while you cover the area with an occlusive dressing. Once this is done, allow the patient to breathe normally and return to a comfortable position. Monitor the patient's condition for 24 to 48 hours. After the removal of the PICC line, monitor the patient's condition for 24 to 48 hours. Observe the patient for any signs of infection, such as fever. Also, observe the site for bleeding and assess the patient for any difficulty of breathing. The dressing should remain in place for 24 to 72 hours, depending on the length of time the catheter was used for.